Okay, so the next thing we'll talk about is submersion injury or drowning. So drowning can happen in any body of water. The most likely body of water or collection of water is going to vary by age. Infants and toddlers are very top heavy. If they fall over, they can't always right themselves. And so even bath water, toilet, mop bucket, the little small baby swimming pools, those things are drowning risk. For older kids, it's more likely to be for maybe preschoolers getting into the pool unattended. As they get older, it's more likely to be kids who are swimming alone or who don't know their abilities and they're not a great judge of their abilities. So they get tired or they have some kind of accident or injury. So we need to be teaching children and we need to be teaching parents about safety. So for infants and toddlers, that seems like don't leave the bathroom door open. Don't leave the mop bucket sitting. Don't leave them sitting in bath water. For older kids, if a family has a pool, it needs to be fenced and locked. Kids should know never to go swimming alone. Even adolescents, if they're swimming, should be with a buddy and should have, even adults really need to have someone else with them, especially if they're in natural bodies of water, and they should know the area they're swimming in and not take unnecessary risk. We've had a couple of drownings. We actually, every year we have a few drownings in Mountain Fork River or at the lake because people don't know the water they're swimming in. They don't know the hazards there. Drownings are usually accidental, but they can be fatal child abuse. So if the story doesn't match up with the injuries, make sure we're paying attention to that. So what happens when someone drowns? When someone is submerged and aspirates water, that causes injury to the pulmonary system. So when you aspirate water into your lungs, the alveoli full of water cannot exchange gases. But also that water causes inflammation. And if there's anything else in the water that may increase that inflammation, risk for infection. Because we can't exchange gases during the time period, there's water in the lungs instead of air, that can cause hypoxic injury to the rest of the body and also hypoxic brain injury. So we have a mechanism to protect us from getting water in our lungs. When we're submerged, we often have a laryngospasm. It's a reflex that decreases the amount of water that's aspirated, but also when that person is back into the air, or if they're bobbing in and out of the water, it may make it impossible for them to get air in during those times that air is available. The inflammation from aspirating water can cause ARDS. If there is any contaminant in the water, it can cause pneumonia. That inflammation can set up a site of infection that can cause pneumonia, and they can even develop abscesses in the lungs. So how many of you have heard the term dry drowning? There's a lot of stuff on social media about dry drowning, where someone has a near drowning incident, they seem to be okay, and then wake up in the middle of the night and they're actually short of breath and respiratory distress, and some of those children have actually died. That's ARDS related to the lung injury from aspiration. So any child who's been submerged and potentially aspirated water needs to be observed, and if they begin to show any respiratory distress at all, they need to be evaluated. The cardiovascular system, there's what we call an intrapulmonary right to left shunt. So you're used to thinking of shunts as when there's an abnormal opening between the two sides of circulation. Blood either goes from the left to the right or the right to the left, depending on pressures, right? So if the circulation is a closed loop the way it's supposed to be, if blood goes to the lungs and there's no oxygen to get, then that deoxygenated blood just continues into circulation. And so that's what that person is, circulating deoxygenated blood. So that's called an intrapulmonary right to left shunt. After the oxygen in the lungs is depleted, the blood traveling through the pulmonary vessels is not oxygenated, and they continue to circulate deoxygenated blood. Hypoxic brain damage is the greatest cause of death and disability from drowning. Hypothermia is common in submersion injury. So if the water is usually colder, if that patient is hypothermic, that actually slows the metabolic rate, and it slows the rate of hypoxic damage. So that hypothermia can work in their favor. Management, the patient should be resuscitated at the scene, or resuscitation should begin at the scene. They should be transported with maximum support. Resuscitation effort should continue until either the patient experiences ROSC, return of spontaneous circulation, or their temperature returns to normal. And they say this, EMS will say, you're not dead till you're warm and dead. And that's because that because of the protective effects of hypothermia. So if they're hypothermic, been submerged, they're going to attempt resuscitation, and they're going to continue to attempt resuscitation until that patient either recovers a heart rate or their body temperature reaches normal. After ROSC, if they do achieve ROSC, they have a return of spontaneous circulation, that patient needs supportive care. They may still need to be ventilated depending on how severely they're injured. If they're asymptomatic or minimally symptomatic, anyone who's had a drowning or near drowning needs to be observed for 6 to 8 hours, because it is common in the hours after that incident to have respiratory symptoms recur. They can develop ARDS, like we talked about. That's the dry drowning thing. They can develop cerebral edema, and then a few days down the road, they can develop aspiration pneumonia. So they need to be observed and monitored afterward. One of our major roles in nursing is prevention. Lots and lots of community education, lots of anticipatory guidance at well visits. One thing we need to know, kids should have swim lessons, but even kids who have had swim lessons and know how to swim should not be left alone. Small children with any amount of standing water, but even older kids shouldn't be swimming without some kind of supervision. And one thing to be aware of is that drowning doesn't look like drowning. In the movies, we see somebody splashing and flailing. Most of the time when someone drowns, they go under silently. So one of the most dangerous situations is, say, a poolside gathering where there are several adults and several children. When there are more adults, all the adults tend to relax a little bit, thinking there's more eyes on the kids. Sorry, they tend to relax, thinking if there's more eyes on the kids, they can relax a bit. But if that supervision is spread thinner, then it can be easier for someone to go unnoticed. So, and the kid in the swimming pool, there's 7 or 8 kids in the swimming pool. The kid at the bottom is not visible. So parents should be taught when their kids are at events that involve swimming, they need to be monitoring continually to make sure they can see all of the children. The prognosis is best if they're submerged less than 5 minutes. If their heart is in sinus rhythm, they have reactive pupils, and they are responsive at the scene. The prognosis is worst if they were submerged greater than 10 minutes, or if after 25 minutes of advanced life support, they're not responding. If that patient has no spontaneous movement or normal brainstem function within 24 hours, then severe neurologic damage or death is likely. So prevention is always better than management, but management or resuscitation continues until they're warm. And then even kids who don't require resuscitation or who are resuscitated very quickly need to be monitored for a while for complications. Okay, the next section, we're going to start talking about some tumors that involve the nervous system.